Hello, I'm Samata Sharma. I'm the medical director of the Brigham and Women's Hospital's Bridge Clinic, which is a low-threshold addiction treatment center. I'm also the chief medical officer of WOY Mass, which provides a consortium of behavioral health clinics across our state. I have had the privilege of doing some work in trauma treatment and gender violence in association with the Acid Survivor Trust International, which is a London-based nonprofit organization that's just done some incredible work. And they really have had incredible impact in this space. And I've had the privilege of being able to accompany them in parts of their journey.
Welcome to India and Indian News. Our guest today is Samata Sharma. Samata, welcome to our show and studio.
Thank you so much, Upendra. Thank you for that very generous introduction.
Excellent. So we were very much impressed by the work you are doing. And personally for me, especially the mental health is very important because that's the one, especially if you look in the South Asian and Indian community, that is not given importance. If there is a cancer patient, they will go and get the treatment. Mm-hmm. But if there is a mental issue, they will say, okay, it will be okay. There is a big taboo. So I want to talk about that. Also, as we were talking off the camera, you mentioned that you did some work with the acid survivors, and that was in Colombia. Mm-hmm. And I'm surprised. I thought that the acid victims were only in India and South Asia. So let's start first with your medical work, like what you do as a medical director.
Okay.
Okay.
So as a medical director, I actually probably have one of the best teams in the hospital. I'm biased, but I really think it's an entire team. It's not just by any means me. Mm-hmm. The team is really what makes this work. We oversee the Brigham Bridge Clinic, which is a low-threshold, low-barrier addiction treatment clinic. And what we mean by low-threshold and low-barrier is that traditionally, there's been so many impediments for people to be able to seek treatment for addictions or mental health. What we're doing is a way of lowering some of those impediments so that people can come to treatment, they can walk into the clinic, they can get medication on demand, they don't have to deal with insurance, we're payer blind. So we're making it just easier for people to access treatment, particularly for people who haven't actually been able to access treatment very easily before. So traditionally underserved or underrepresented.
So anybody can just walk in?
Anyone can just walk in if they need treatment 5 days a week.
That's a great service. And how it is funded?
So we've had some very generous donors. Our actual full name of our clinic is the Eliza Dushku Palangian and Peter Palangian Bridge Clinic. There have been two of our incredible supporters. We've had other donors that have been just as involved. So we have relied somewhat on the largesse of our donors, both their monetary contributions, but just the spirit with which they've contributed and just the humanism that they've really kind of shown our patients who don't usually get seen in that same way. And then we've had some added grant funding, and our hospitals have also generously funded some of our.
So now addiction and mental health, these two are, is a very important issues, which are again, not paid so much attention, and they have devastating impact on the family life, the relationships, and everything.
Exactly.
So let us talk a little bit about addiction. What type of addiction patients you get?
We treat everything.
Yeah.
So there's a large spotlight lately. Everyone's heard about the opiate epidemic and how that's been ravaging communities. And unfortunately, that's still ongoing. But alcohol, to this day, kills more people than homicides, suicides, motor vehicle accidents combined globally. Smoking, even more so. And so these things are so firmly entrenched in so many different cultures and often not given the same amount of attention as, say, someone's hypertension or someone's diabetes. Though we know that having an addiction, often even having a latent addiction that people keep hidden, right? Or that people might not know to ask somebody about, even in the medical setting, these things drive and lead to worse outcomes in chronic diseases. And we know that if we can get that addiction treated, so much of someone's health, physical, mental, spiritual, changes for the better.
So now I want to focus a little bit more on the alcohol because most of us are very familiar with that. It's a social drink. You celebrate, you are
everywhere.
Happy, you are sad, you drink. So somehow, as a professional, you can give us, our viewers, some idea. What are the 3 or 4 symptoms they should be looking for before they really become addicted to alcohol?
Yeah, so things in moderation, right? Like you have to enjoy life. So things done in moderation are reasonable, right? It's when you notice that it's difficult to moderate and it starts building up, and often it starts building up insidiously. But you might find yourself getting to a point where you really are trying to cut back and are struggling to be able to do that because your body is craving it. You might find that it's the first thing you think about when you open your eyes, right? You might find that, are you a little shaky or unsteady in the morning until you have that first drink? Have you noticed, or have people in your life noticed you're drinking? And are you starting to feel guilty about it? And these are all things that help you sort of assess, like, is this moving from something that I do only occasionally socially as part of a pleasurable evening to enhance my experience to becoming something that really I'm more of a slave to than being in control of?
So the control is the key indicator.
The ability to regulate.
The ability to regulate. And regulate means also control, trying to understand.
Yeah. So as long as you, and I hesitate to kind of say it in that way simply because people might think that, oh, then why don't you just do it? Like, it's not like are you not motivated enough? Or you not have like the character strength? And it's not about that at all. It's how the brain changes in response to this substance. And so people who are vulnerable to certain brain changes when confronted with an addictive substance might find that over a period of time, they lose that ability to like regulate. They don't have the same volition. They're not able to put the drink down because their body is craving it, right? And their mind starts craving it. People that aren't as vulnerable to it, right, are able to maybe have one drink, and one drink doesn't turn into 5 drinks or 10 drinks. But people that are vulnerable to it will find that even with one drink, even if they don't want to necessarily have drink 2, 3, or 4, there's a biophysical mechanism, right? There's a change in the brain and the body that drives that need to keep having drink 3, 4, or 5. And we know that having an addiction, having a struggle with any sort of neuropsychiatric illness changes the brain. So it's not lack of motivation. It's not lack of willpower. It's actual functional changes in the brain that have to be treated in order to normalize. Just like blood vessels might constrict over a period of time, right, and lead to hypertension if it's not treated. This is the same idea and the same model we should be approaching addictions with.
Okay. So, and then, somebody just walks in and says, look, I want to, do you hospitalize them, keep them in the hospital, or it is?
If they need it, a lot of times, if people walk in, they'll find that we have really effective treatments that work incredibly well. But most people, 90% of people that actually need treatment for mental health, particularly addictions, do not receive it. And so much of that is due to the shame and the guilt surrounding the illness and the trauma that we as a society perpetuate on people trying to seek treatment. Having an addiction is traumatizing to a certain extent. Seeking treatment for it shouldn't be. But so often these patients are looked at as, marginalized in society as kind of patients that people don't want to quote unquote deal with. And that's changing a lot these days. And we see particularly this next generation of medical students and residents really interested in learning how to treat addictions. But I think what they find and what patients find is that we have really good treatments. It works. Having an addiction does not mean that you're relegated to suffering your entire life. You can get quite better. You can do quite well as long as you're able to access that treatment.
And what about mental health? Let's talk about that. Yeah. So, because mental health is especially a big taboo, especially among the immigrant, the Asians and South Asians, Indians. And we can see that there is a problem, but at the same time, we think of what people are going to say. And because, there was the mental health really was not institutionally established in India, because people will declare, oh, this person is mad or this person is crazy. And that was it. And that stigma still continues there. Yeah. So what are some of the signs we should be watching for the mental illness?
Yeah. So I think the big issues often, particularly in the younger generations, right? Like we speak about this epidemic of loneliness that was exacerbated with the COVID epidemic.
Sure.
We talk about Gen Z, even though they're the most digitally interconnected generation ever, they still feel isolated and lonely because they don't have that necessarily same social cohesion, in-person contact that generations prior had to rely on to see someone, right? We couldn't just sort of text them or look at their Instagram. So I think part of it is, do you find yourself withdrawing from activities that you previously used to enjoy? And this is more for kind of if a low mood ends up actually turning into depression. And one of the things, I'll list a few of the criteria, but one of the distinctions I think is really important to make is that depression isn't just feeling sad. Feeling sad is a transient state. People feel happy. People feel sad. People feel mad. People feel jealous. People feel a lot of things. Feelings are transient. Depression is actually a change in the structure and function of the brain that over a period of time leads to a set of behaviors that feel maladaptive.
And what is that time frame roughly? Like how much it might take?
Textbook criteria, we say for at least 2 weeks, the following behaviors, if they persist, that's a sign that maybe something is astray. And that's, do you feel less socially engaged? Are you losing interest in activities that you previously used to enjoy? Do you find yourself with low mood that persists for 2 weeks or more, pretty much constantly? And low mood can be sad, but it can also be apathy. Like, do you just not feel interest in the things that used to fill you with joy? Are you not pursuing, or do you not have this zeal for doing things that you used to enjoy doing? Has your sleep changed? Has your appetite changed? Either eating more or eating less, depending on the type of depression, can be a sign of it. Has your energy level changed? And has your concentration changed? All of these things, when you feel your best, you operate kind of on one plane, right? And what depression does is it depresses the ability to optimally function.
What about mood swings?
So mood swings can be something of anything, right? Like we all, to a certain extent, can have mood swings at certain times.
Okay.
Like,
so that's nothing serious, like,
So the serious aspect of that would be something like bipolar disease.
Okay.
And that's a very specific set of behaviors and a set of symptoms that have to occur gradually. That starts rather young, in early adolescence, or sort of in like the late 30s. There's 2 peaks of it. And these symptoms, these are different. These are mood swings that are characterized by like very intense, erratic feelings of either mania or depression. So either feeling like you're on top of the world, you're invincible. You might be doing projects or things that you never had done before, spending money exorbitantly that you don't have, taking a train and going off in the middle of nowhere without telling anyone. People might notice that you're speaking faster, that you're sleeping less, that you feel like you're being run by a motor. On the other hand, that then leads to a depressive crash where you have those symptoms of depression, but even more pronounced. So that's really this mood swing that we're looking at when we're looking at bipolar, 2 poles. But generally, like kind of feelings that come and go, right? Like you might be like very, very angry at someone for some time and that subdues and like you are able to patch up that relationship. That's not a psychiatric illness, right? A psychiatric illness is a very serious, but very definable thing.
What about, so what is the role of friends and family in both, in addiction as well as in the mental health?
Yeah, and I think addiction and mental health actually go hand in hand. Like there often has been an artificial distinction between the two, but I don't think there should be one, because treating one often means that there is an underlying issue with the other. And we call that dual diagnosis. And a lot of people struggling with mental health issues might turn to substances, right, as a way of self-medicating and feeling better. Obviously, that leads to later problems. But I think anytime any of us, right, are in pain, whether that's physical pain or psychological pain, you just want to reach for something that makes you feel better faster. And an addictive substance does exactly that, right? So it's like a momentary escape or a release, but obviously over a period of time, it leads to really deleterious outcomes. And so I think with friends and family, one, it's recognizing, right, and encouraging someone to be able to talk about what they might be going through, and to talk about it in a way that doesn't feel judgmental, and to just let them know that you're there to hear their story, right? And they don't have to say anything. They don't have to perform, or they don't have to like be anyone other than who they are in that moment for you. Even if who they are in that moment feels very different from who they normally are at their best self.
And I think that's where, I think what you were saying, that is where the whole problem starts, when I'm trying to be who I am not.
Yeah, I agree.
The projection starts and you want to be, and then in reality, you are not that. So, a friend and family can help you without being judgmental.
Yeah, and I think, with depression or with anxiety, like really debilitating depression or anxiety, the signs are there, right? And the person is aware that they're struggling with something. I think knowing that if they were to turn to someone that they trust and love, that what they're struggling with would be heard empathically, right? And not dismissed, or would be heard in a way that doesn't make it all about what they're struggling with, right? Someone who has high blood pressure, we don't refer to that person as a hypertensive, right? That's not their defining trait. But someone struggling with an addiction, we refer to them as an addict, right? Struggling with a disorder should not be the defining trait of someone. So I think reminding them that this is something that you're going through, that we will get through together, and this does not define you by any means. I also think a lot of times we look at mental illness as a frailty, right? Something is wrong with you if you have this disorder. And I think it's also important to remember, and I'm a big advocate about this, is approaching things from a strength-based perspective. So it's not just that someone who is prone to anxiety has, this disorder. The brain that's actually prone to anxiety might also be primed to more empathically connect with someone. It picks up on nuances, on body language that a lot of people don't pick up on. That's sometimes the flip side of anxiety, the brain that pays very close attention to very fine detail. And it can't always filter out that detail for what's, innocuous and what's not. That's what's caused anxiety. But that attention to detail also lets someone connect or understand someone even if they're not speaking. Like, so there's a level of empathy that a brain that's prone to anxiety might have that's far superior to a brain that doesn't. So I think being able to see mental illness or structural and functional changes in the brain as part of a compendium of not just symptoms, but parts of persona, parts that make up who you are. And I think that normalizes it, which is important.
What about if you look at the younger generation, young kids? What will be the sum of the warning signs? Like sometimes if you look at, the parents never suspect that their children can do wrong. And is there any way to diagnose, if this happens to your child or this child does this, take away that your faith in him that he will never do wrong? You should be careful and aware of that. Is there any warning signs?
I don't think it's about, I think a lot of parents believe that no harm will come to their children, exactly, right? And nothing, and they don't even want to think that something bad can happen, whether that's a physical illness or kind of a mental health issue. I think one is to understand that the mental health issue, just like the physical illness, can be treated. The brain and body are connected. And so as normal as it is like going to the doctor for a cold, right? Or going to the doctor for diabetes medications, chronic illnesses, the same way it should be normalized about being able to go to the doctor to have this conversation to get your depression treated. I think as parents, even if they're not, if they have teenage kids, like the kids have their own friend group and are out kind of doing their thing, parents still have a very astute understanding and connection, right? Inherently with their child. And if you think or you notice something is off, that your child isn't really acting the way they used to, or that they feel more withdrawn, or that maybe they're more irritable, or that, something just feels more off than normal, let's say teenage angst. I think that's an opportunity to start opening the door for a conversation in a very non-judgmental way to just listen. And it might not happen the first time, right? They may not feel like they are going to open up to you and tell their parents everything that's going on. But I think the more readily a parent is able to make themselves present for that conversation without judgment, without stance, just being present, the more likely over a period of time that child is to turn to them. And it really ultimately will come from the child. Treatment works much better if the person who needs treatment wants to seek it out.
So the message is that there's a treatment. You should be treated.
Yes. There's treatment and there's hope. This is not something that is an impediment that cannot be overcome, right? Sometimes it might present certain challenges, but a lot of illnesses present challenges. Life in general presents challenges, right? Sure. And I think arguably, particularly with addictions and in mental health struggles, the ability to talk about it takes courage. It shouldn't have to take courage, but it does take courage. Sure. So that already suggests that the person struggling with this issue has a level of courage, has a level of fortitude, right? Strength-based. And so they use that to access treatment. And once they're able to access treatment, they get better. I think in hindsight, they realize, wow, if I can tackle this thing, what can't I do? Sure. It's about building confidence rather than feeling like they have to shirk away from it.
Yeah. So now one thing I learned from today from you was I was aware that the acid violence happened only in South Asia and India. But you told that it happens in Colombia as well. And you have been involved with that project based in London. So tell us about that. How did you get involved with the acid victim survivors?
Yeah, so Colombia is actually the country that unfortunately leads the world in acid attacks. Yeah.
I thought it was India or something. But
right, and I think a lot of people think that. And some of this work is done both by the incredible government in Bogota, Colombia, a consortium of a specific department dedicated to women's health and women's issues, and in partnership with ASTI, which is Acid Survivor Trust International, the London-based nonprofit. And this is really ASTI's life work, and they just do an incredible job. And one of the reasons that they had thought about Colombia is Colombia actually, this one small governmental organization dedicated to women's health and women's issues has created a pretty significant trauma-informed structure for helping survivors of acid violence access care. And my sort of role in it was that I reached out to ASDI and wanted to do something with the mental health aspects of trauma, right? Because there's certain very specific issues that come with a victim who's been, one, a survivor of gender violence, but two, survivor of gender violence that changes the composition of the human face, right? Because that's the first thing that we look at. It's how we talk to each other. It's how we relate to each other. And so that's a whole other set of psychological processes that come from that trauma. And my goal was to try to understand what these survivors are going through in a way that really highlights their resilience, because it's often women, but not always. These are survivors that have incredible amounts of resilience, right? They've survived something so harrowing and they keep going. And part of it was for me to provide, I hope, a platform, like an academic sort of partnership or platform for ASDI and for the Colombian, the Bogota government to really showcase these innovations in treatment delivery and understanding that this nation in Bogota has been able to do for these women, and really to create sort of an optimal treatment model that combines mental health, occupational rehabilitation, legal access to care, and a platform for survivors to have voices. So this whole holistic aspect of treatment, how do we take this model and how do we apply it to other parts of the world where the same things are happening in a culturally specific context?
So now let's come back to how did you get interested into medical?
Into medical? Yeah. Well, I am born to Indian parents.
Yeah, sure.
I was always interested in how the body, works, but more so really in how the brain governs the workings of the body. And I think my talents more so were in literature. Like I really was drawn to stories, like understanding people's stories, understanding people's narratives, because so much of someone's story shapes their thoughts, right? Which shapes their perceptions, which then ends up shaping their external experience. And I think if you were able to understand someone's story in its entirety, right? The complexity, the challenges, the victories, you get a much better sense of who this person is. And regardless of which disease you're treating, you understand how that disease, right, interacts with that person. So it's a very holistic view. For me, medicine was really going to be psychiatry. Like that to me was the best way of combining this expression or connection with someone's narrative with actually, how do I use that narrative? How do I change someone's perception and their story to create a narrative for them that's much more healing, right? And how do I do this from a neurobiological level with how the brain changes? And how do I do this from kind of a psychological or a psychosocial level where their perception of themselves also changes for the better? So I think psychiatry is one of the most empowering fields in medicine. And I don't think it's often seen that way, because we tend to think of people with like severe psychiatric illness or addictions that are so beyond help. And unfortunately, that's, I think, the default social perception. That's changing, but it often was. And that prevented people from often seeking care, or it gave them the sense of hopelessness. And yet we know that people who get care do really, really well. And so I think ensuring that that narrative changes in a way, and that empowering people who have access to treatment to be able to share their stories is, I think, so impactful, because it shows people, one, that they're not alone, that there is hope, and that there is treatment available.
You also explored music as well.
Yeah.
So let's tell us about your music history.
So I studied piano for quite some time. I was not the most adept piano player. And so I moved on to voice, and my voice kind of just took for opera. That's the only thing I could sing. It's probably the only thing anyone wants to hear me sing, if even that. And so, to me, music was a way of using a type of art to express something that otherwise maybe felt inexpressible or felt so expressible that it was universal. And so I studied in college, and then I took a year in between medical school and residency to study in Paris, to study opera in Paris. And then I came back here, and one of the things that I was really lucky to have were just incredible mentors in my residency, in my fellowship, and even now. And they really kind of provided me a way of understanding that, look, music also emerges from the brain, and music actually changes how the brain oscillates or responds to it. So I thought that was like really incredible, that music could impact the brain, that something that's a human creation could then recreate in certain ways aspects of human cognition. And like, music has this power that is so transcendent. There's a reason why it's happened since we had instruments, right? And music precedes man. Cro-Magnon man used music. So it's something that's so firmly entrenched in our DNA. And I think there's reason for that. And I think what it does is it helps us communicate and link with each other in a way that goes beyond words.
And role your parents played in your life?
So I'm an only child. So, and hopefully that was...
It must be very tough to be the only child, or it was...
No, growing up, I
you
thought
had
it was
all
great.
the attention and everything. Yeah,
and now as I get older, I think it would have been very nice to have siblings to share that experience with. I'm lucky I had very close cousins and family friends and just friends who are like family. But, my parents were always there. And in ways like they had very different backgrounds in terms of like what they studied and what they worked in. My mother was a forensic social worker and my father was an engineer and physicist. And so I think he was hoping that I'd go down more of like a math path, which we saw early on was not really going to happen. But, I think what he taught me is to like look at things analytically, right? Like kind of look beyond sort of what's just on the page, like try to read and try to like understand beyond just what you see, probe deeper. And I think what my mother kind of really showed me was just how to connect empathically with so many different types of people. Or let me say that, like, I hope that I connect empathically with so many different types of people. I guess someone else should actually say that about me. She just taught me, like, I think, embodies resilience. Like, she came to this country at a incredibly young age. She put herself through college, through her master's program. She got to a point where she was helping some of the most vulnerable, the most psychiatrically ill members of society, and never lost like her desire to want to do the work. She,
and your parents met here?
No, they were arranged.
They were arranged.
Yeah, and my mom came here very, very young.
Okay.
So,
yeah. Excellent. Now before I let you go, I have to, since with the psychiatry, I have to talk about Carl Jung.
Oh,
which is I have read almost every book you can think of.
Yeah, you told me you read the Red Book, which is very impressive. And the Red Book, which is very, I had to wait 3 months because I didn't want to buy $300 book. So the library made me wait for 3 months. And finally I read it, and then I read it for the second time. Second time it was easy because it was at a level. So what do you think, the role Carl Jung has played in psychiatry? I think he's one of the fathers of the field, right? Along with Freud. And I think he made the subconscious, like he gave it words, right? So he made the subconscious experience accessible and he made it kind of feel like it's this thing that's actually worth studying, this entity, rather than something that we're just supposed to ignore or push away. And I think a lot of like his theories and what he puts out there academically have a role in just tracing the history of psychiatry. But I think a lot of things that he also talks about are things that we really actually haven't studied fully yet. So a lot of like...
his concept of shadow.
Exactly.
I mean, what a fantastic contribution that, we all have that, we have...
the shadow self. Yeah.
The shadow self, exactly. Yes.
Yeah. And I think what he was like a very astute explorer and scholar of the human experience.
Yes.
Right. He made that also very universal. And dreams are universal, right? Symbols associated with dreams, there's some universality to that and also some cultural specificity. But the idea that the subconscious and the dreams shape part of our unexpressed desires or wishes or memories or whatever it is, only recently are we really starting to study that.
Sure.
And we are studying that as the technology has caught up. We can image the brain, right, as it's dreaming, or we can put electrodes on someone's head and look at like what the brain rhythms are actually doing, and try to sort of piece together what it is that this means. But what we're finding is a lot of times we dream about things that are salient to us. We dream about things that have intensity of experience that we somehow subconsciously have to work out in our sleep. Hence why people say sleep on it before you make a big decision or don't go to bed angry. And I think what sort of the science is showing is that some of the theory and some of the things that Carl Jung was even just talking about or thinking about a century prior kind of integrate. They kind of go back to that concept of synchronicity, I think, in that way, and that things are interconnected. And I think philosophy and theory allows us to think about these really big things and like this big picture. And then science on an evidence-based way, sort of step by step, shows us how to get there.
Now, tough question for you. So if you're given the Freud and the Jung, who is your number one most influential between these two? Who is more powerful, you think?
I like Jung's theories much more. Like Freud, with all due respect, I think really kind of brought like a bit of neurology into psychiatry before the fields diverged. Now they're coming back together. So in a way, he was like kind of a vanguard in the sense that psychiatry and neurology are also intertwined. They're not separate fields. But there's something I think just deeply poetic about Jung, right?
Yeah.
How he approaches
and that's what I love about, I said earlier that I have read almost every book, including the Red Book of him. And I thought, he really made a huge contribution. And of course, there's always debate between Freud and even they had a falling apart.
Oh, yeah, of course. Ego, right?
The ego. Yeah, exactly. Yes.
Yeah, but I think, with Jung also, he influenced literature. He influenced a lot of other field philosophy, certainly, in certain ways that are, he kind of had a presence and an impact in larger cultural spaces and larger sort of liberal arts.
And, somebody could write the Red Book in his deep, darkest moments of all those years. He had to have courage, and that's why his children did not want to release that Red Book, but they said, no, it is a great contribution to the world of psychiatry, and they did that. I'm so glad they did release the Red Book. Okay, on that note, Samata, thank you so much for coming, and we are looking forward to seeing you on April 26th.
I'm honored to be there. I'm very excited.
Excellent. Thank you so much.
Thank you.
Good.